So my name is Dr. Coral Kirscher. I'm a DNP FNP at Renew Health and Wellness. I specialize in weight loss, women's health, hormones, thyroid conditions, and functional medicine, anti-aging, a lot of other different things. We try to stay on the cutting edge of everything as far as research goes. So we're always updating. And I'm actually a husband-wife duo. So my husband is Dr. Micah Kirscher. I met one other person here. We actually met in school, so he has the same licensure as I do, and he specializes in weight loss, men's health, and hormones as well. He couldn't be on tonight, but he is watching our little one, which I've included in here. This is Harbor Kirscher, and she doesn't have any credentials just yet, but she specializes in breastfeeding, crawling, and playing peekaboo. So she is very much part of the team here. First-time parents. So if you guys have any suggestions for us, let us know. So a little bit about Renew Health and Wellness. Before we get started, we do offer a host of other things. Pain management, especially when it comes to utilizing more natural therapies like exosomes and PRP. We do women and men's hormones, functional medicine. We do a host of anti-aging things, hair restoration. We have a mobile IV and an office IV. We try to really, customize those IVs for patients. Obviously, weight loss, like we're talking about today, and a lot of athletic performance stuff. All right, so what's semaglutide? Well, we're all here for. So semaglutide is the generic for Ozempic, Wegovy, things like that. It is a GLP-1, which basically means that doing a lot of different things as far as to the body. And we're going to go a little bit more sciencey into that as we go into other benefits to semaglutide and how it works in the body. And it is a once weekly sub-Q injection. That just sub-Q means that it just goes right into that fatty area. So not painful at all. A lot of our patients tell us that they don't even feel it. What it's doing though is it's helping you make you feel fuller longer by reducing that appetite, which is really important. But what the best thing that it really does is it's normalizing those blood sugar levels. When we normalize blood sugar levels and regulating insulin responses, what we're doing is we're trying to reduce that belly fat. It's really, really important as we're starting to lower our cardiovascular, all those different types of things, and really try to get rid of that spare tire, which a lot of my women patients tell me that it's really, really important to them, especially as we're getting through that perimenopause into the menopause and postmenopausal state. So that's what we're really trying to accomplish when we're utilizing the GLP-1s. As we go into this, you'll notice that we have other benefits to the semaglutide too, and what the GLP-1s are doing. All right, so how fast and how much? Slow and steady is our main focus. We really want to think about, utilizing, we only really want to think about losing about 1 to 3 pounds per week, depending on how much we have to lose. Everyone is different. However, we normally see progress right away. So that is something that, we see progress within the first month of starting our program. But what we really want to make sure of is that we go slow and steady. Slow and steady, what helps that and what is to maintain the weight afterwards. And so when we're going slow and steady, we're thinking about going back to homeostasis. Body balance is really important. So that way we can maintain long term. Some of the other benefits of semaglutide too would be like anti-aging is a huge one because we're trying to lower that inflammation response. We're also trying to lower the cardiovascular events by about 20%. I have a lot of patients I can get off cholesterol medications and blood pressure medications because we are trying to reduce the cholesterol, LDL, raise our HDL, and improve that brain fog. Semaglutide was actually initially studied for cognitive decline. And so therefore I have a lot of patients that tell me, oh my gosh, I can just I feel so much better. I feel like the fog is lifted. So there's a lot of other benefits to that semaglutide. Um, I want to go back and make sure we talk a little bit about the different types of semaglutide that we utilize. As like I said, we have the brand names, Wegovy, Ozempic, they're indicated for different things, but they are the same thing. They're semaglutide. Contrary to popular belief, compounded versions are safe and effective. So the negative publicity that we generally see in the news is based more on that salt-based compound, not the version that we use. We do not use the salt version. And I actually personally like the compounded version a little bit better because, sorry, I gotta admit somebody else, because there's less fillers. So we're able to control that ingredient list a lot better. And, being from a functional medicine background, I like to reduce the amount of toxins in the body. So I like to make sure that we can we really think about what's going in our bodies. And so reducing that list and understanding that this is third party tested and actually is very effective is a great benefit. All right. So this is what I was talking about when it comes to how the GLP-1s work in the body. So obviously it's working on cognitive, reducing that cognitive decline. It's helping the pancreas secrete a little bit more insulin, which is really, really important when we're talking about regulating that blood sugar level. We are delaying gastric emptying, and in the gut, we're thinking about reducing the motility a little bit. Lipolysis, we're increasing, which is great for reducing the amount of fat cells. We're reducing the amount of glucose production in the liver, which is good because then we're not storing that fat as much. And the skeletal muscle, I want to point this out a little bit because this is something that really happens when it comes to weight loss, is that a lot of times we're not just losing fat, we're losing muscle too. So, and that's really important when we maintain long term. So a lot of patients who have been on phentermine for a long time or just short periods of time, what happens is they may lose up to 30% of their muscle mass. And that is not good because what happens is that we are not, our metabolism is not as good as it was. And so therefore, when our metabolism is good as it was, we're not burning as many calories. So, you may think about, okay, well, I used to be able to burn 1,500 calories a day just at rest, but now it's maybe 1,300. And I'm just throwing out those numbers. But then you're storing those 200 calories because maybe we went back to eating the same things we were eating before. So really important to think about is that it is increasing that glucose uptake into the muscle mass. And so we're actually maintaining muscle or even building muscle. And that is something we take really seriously here at Renew Health and Wellness. As far as the inflammation, we are reducing the inflammation in our immune system. And then you can really see that it does a host of all things in the cardiovascular system. So lowering that cardiovascular risk by about 20% is huge. All right, so how do I know if I'm a candidate for weight loss? Well, works best in patients who want to lose at least 10 pounds. So I have some patients who come to me that, they just have about 10 pounds to lose to kind of normalize that BMI. Wanting to reduce medication use, especially with blood pressure medications, statins, which is what we're doing to lower our cholesterol. Helping with anti-aging. I have a lot of patients who use small doses just to help with inflammation, chronic joint pain, those types of things. Or when we are normalizing our blood sugar levels and our insulin responses too, we want to think about that. This is, I have most of my patients who come in that are cancer patients have an elevated A1C. And so therefore, when you normalize your A1C, you are thinking about reducing your risk for cancer. So, cancer and bacteria and all those different types of things love sugar. Another thing we want to think about too is that, do we have a family history of C cell tumors as far as the thyroid goes? In rats, there was, when we were studying this medication, there was a couple of things that did come up in rats. We don't see this much in humans. We're not a whole lot different than humans, but there is a black box warning on this. And so that's something to consider.
Yeah.
Okay, so what if I'm not losing weight on semaglutide? So here at Renew Health and Wellness, we do a pretty good job with tracking, managing food intake, and that's not for everyone. We understand that, and we kind of meet patients depending on, because this is a very customized plan. We think about, the types of foods. that we're eating. And so therefore, sometimes patients need to reduce their dairy or their gluten or their soy or something like that that's kind of a little bit more pro-inflammatory. So we think about those types of things too. We manage, sometimes food logs. Sometimes we'll, manage what their grocery list is, macros, things of that nature. As far as those types of things, we can help with those. But also, I like to dig a little bit deeper. I'm more functional medicine minded. So sometimes we check female and male hormones. Sometimes if those are out of whack or our stress hormone's really high or something else is going on, such as like a thyroid condition or GI dysbiosis, which means that, maybe we have some type of gut issue like an infection or permeability. And then if nothing else is working, we sometimes will switch to trizipatide. Trizipatide is Mounjaro. Let's see. So what's trizipatide? Trizipatide is Mounjaro. Mounjaro is a GIP and a GLP-1. So what's the difference? There's two systems that work with the trizipatide or Mounjaro versus one with the semaglutide. So basically, you're adding in a little bit more insulin activity, which may increase those weight loss results. Also, with trizipatide, you go a little bit higher as far as dosage go, but we do a little bit different things as far as our dosing at Renew Health and Wellness. Okay, so how do I maintain weight after stopping semaglutide? A lot of times patients think that we have to be on this long term, and you can be on it long term, but it is something that you can come off of as well. So what's really important is that we're managing our lifestyle. It's really easy for us to get to your goal weight and maintain, because what happens when patients start to lose weight, they naturally want to continue that journey and keep that weight off. So we really talk about lifestyle changes. We're talking about changing habits. We want to, we want patients to feel healthy, happy, successful moving forward. We don't want them to need us all the time. And a lot of times, patients feel really good after that, and so they want to continue those habits. Sometimes we'll change the type of food intake, and so therefore, they're tracking things, they're reading back of labels, just a little bit more awareness than they used to be. I always say, just going on the outside of the grocery store is really important. We do offer maintenance programs. So maintenance programs would be something like we're on a low dose amount of semaglutide, and that would be significantly less than what we generally do on a monthly basis. So we offer that significantly less just because the dosage is a lot lower. We would address hormones and deficiencies. And so just like what I was talking about before, sometimes when we have a hormonal imbalance or we have a thyroid condition or we have something else going on, that can really prohibit that weight loss. And then, of course, helping to maintain afterwards. All right, so I've heard there's side effects. There definitely can be. Nausea, constipation, and diarrhea are all common side effects. I've not had a patient though stop this due to side effects, just because we do a really good job with managing that dosage to reduce the side effects. And for some reason, if we do have patients that are a little bit more susceptible to the side effects, we'll do homeopathic remedies. We have a lot of different things that we can help. Just saying, okay, we've got constipation. Let's start you on a high dose magnesium at nighttime. It's going to do a host of other things to help you, but let's do this preventatively as well. All right, so are there any long-term effects? So studies show only long-term benefits to semaglutide, which is awesome. I mean, this medication has been around for a long time. This is not a new medication. The indication for weight loss is kind of like the new hype and the new way that we're utilizing it. But this peptide, it is actually a peptide, was originally created to improve cognitive function, like I was talking about before. So reducing the brain fog, lowering that cardiovascular risk, lowering blood pressure, cholesterol levels, A1C, and of course the anti-aging benefits. All right, so how would I get the medication? So we do offer free in-office or virtual consults with our providers. We have customized individual plans. We do offer the in-office or at-home injections. We do not accept insurance. do have to tell you guys that. But most insurance companies are covering weight loss medications, are not covering weight loss medications. And if they are, most of my patients tell me, okay, I got it covered, but I can't find it anywhere. What do I do? And so they come into the office and we're able to get it for them. We treat a lot of patients out of state as well. So that's something that, even if you don't live in the North Carolina, we are located in Cornelius, North Carolina. If you don't live in North Carolina, we also treat out of state as well. And most of our patients are on this medication for about 3 to 6 months. We do offer the FSA, the HSA, and the care credit as well. So before and afters. This is Shannon, and she looks great. She has done amazing. She did a little video for me, so I'm going to share that.
I am a weight loss patient at Renew Health and Wellness. I actually just hit my 30-pound weight loss goal, which is super exciting. A little bit about my story with semaglutide. I've always been a gym goer. I've done the boot camps, the cycling, the running, the calorie counting, the diets. I've pretty much done it all, and nothing gave me the results I felt like I deserved for the work that I was putting in. Sure, I'd gain or I'd lose a pound here and there, but then I'd gain it back and then some. So there was really never a major noticeable weight loss, which is what my goal was. I needed to lose some weight. I had some pretty bad knee pain, which is partially structural, but partially weight related. And I also had some pretty severe neck and back pain because I am large breasted. But losing weight has made all of those aches and pains go away, which is pretty incredible. I wake up in the morning and instead of, feeling groggy and stiff and hurting, which I'm only 40, at 40, you should not be feeling that way every day. I feel good and ready to go and refreshed, which is the best feeling that there is for the morning, especially when you have kids that you're chasing around and getting to school and getting to work. So that's been a huge blessing for me. And, it's frustrating to wake up as a woman and think, what can I do today differently to lose weight? Like, how can I eat? What can I eat? What can't I eat? Oh, should I avoid this function because they'll be drinking and I shouldn't be drinking or eating? And it's frustrating. It's hard. And when you do all the right things and it doesn't work, it's even harder. So Renew Health and Wellness and Dr. Coral and Dr. Micah have been a huge blessing to me and have given me my self-confidence back again. It's really exciting to fit in those clothes that you have had sitting in your closet for years that you would hope one day you can get back in. I'm here to tell you, you can get back in them. I'm back in them, and it is amazing. So if you're thinking about doing something for yourself, and your overall health and well-being, it's a lot easier to maintain a weight after you lose it than to lose the weight. I'm here to tell you that because I tried every way. And now I'm maintaining my 30-pound weight loss and I feel great. So I highly recommend that you do something for yourself. And if this is what you're thinking about doing, go for it. It's been awesome for me.
Hey, Shannon. All right, I think we have one more here.
Hi, my name's Shannon.
All right, so this is Tina's before and after, and you can see she looks beautiful as well. She has a video as well here.
Thank you, Renew Health and Wellness, for helping me with my weight loss journey that's still ongoing. As you get older, it's more difficult to shed those extra pounds, which is what I was experiencing. What I like about the program is it's safe. I've lost the weight gradually, and I've had no side effects. I feel much better, which has made me more confident in my own skin. The health benefits are amazing. I'm not so sluggish. I have more energy. I sleep better. And more importantly, my biometric numbers continue to improve significantly. My A1C improved from 5.7 to 5.3. My HDL cholesterol soared from 48 to 65. My BMI dropped. My blood pressure has reduced. My cholesterol HDL ratio has improved from 3.8 to 2.7. I would highly recommend Renew Health and Wellness for your weight loss needs. You won't regret it.
Hey, Tina. Awesome.
Thank you, Renew Health and Wellness.
Okay. So we are running a special here in December. It was November and December. And basically, if you sign up, you're going to get $100 off your first 2 months. So if you sign up in December, you would get $100 off your first month, and then also your second month as well. And this is where we are located at 18805 West Catawba Avenue in Cornelius, North Carolina. And Renew Health and Wellness is our website here. Feel free to check us out for more information to learn more about us. If anyone's interested in an appointment, you can call or text us at that 704-612-0011. You will get a follow-up email following this presentation. If you're interested in signing up for an appointment, lots of ways to reach us. I do like to offer any questions or anything you guys have for me. Let's see here, I'm gonna go to the chat here. So feel free to go to the top of the chat there, and I can also unmute everybody too if anybody wants to ask a question. And feel free to raise your hand if you guys have any questions for me as well. I did record this, so if anybody came in a little bit later, then we can definitely send you an email with the recording as well. And if you sign up on Eventbrite, you will have a recording too. I'm receiving that email. All right, well, if nobody has any questions, I'm going to go ahead and wrap this up. Again, our number to give us a call would be the 704-612-0011. You guys are more than welcome to reach out, text or call, and we can get you scheduled. It was great chatting with you guys. Talk soon. Bye-bye.